Opioids are probably considered to be the gold standard of medications used to treat pain. The advantages of opioids is that they're extremely effective in terms of treating pain. People get rapid pain relief, and through subsequent doses they can also get sustained relief. The adverse effects of opioids are many, and this is one of the main reasons why opioids are probably considered to be one of the most dangerous drugs on the market.
Opioids are these chemicals, and they bind to receptors in your brain and elsewhere in your body called opioid receptors that have evolved over millions of years to have a lot of different roles. And one of the roles that they have in your body is to regulate and control pain. And so that's where these opioids have their benefits, the things that we like. But the opioid receptors in your body don't just control pain, they also control things like reward, like feeling good. They also control motility in your intestines, in your gut. And so because when you take a drug like an opioid, it goes to the brain, it goes everywhere. And it's going to activate your opioid receptors in these other parts of your body that we don't like so much.
The issue is that we need to make these drugs safer so that people aren't subject to the same levels of side effects that would happen if they're taking opioids over a period of time. As well as also we want to try to reduce the abuse liability and reduce the ability of these drugs to induce tolerance. So there certainly is a lot to be said in terms of taking these existing currently marketed drugs and trying to understand biological mechanisms that we can exploit in order to try to make these drugs much safer for people that need to take them.
Our work is really aimed at identifying the molecular mechanisms by which opioids work in your body. Once we know those mechanisms, once we know which mechanisms produce the good things like pain relief, which mechanisms produce the bad things like side effects, we can design new drugs that target the signal transduction to selectively give us the pain relief without the side effects like reward and addiction. And we're moving towards doing that now by advancing these drugs towards clinical testing.
One of the issues with opioids is that opioids are really only truly effective when they're able to get into the brain and access opioid receptors in the brain in order to elicit pain relief. And this requires opioids to have the ability to cross the blood-brain barrier. The problem is that opioids are often packaged with other pain-relieving medications, and a classic example of this is acetaminophen. What we've noticed in our laboratory is that acetaminophen, when taken at high daily doses, they can damage the blood-brain barrier. By damaging the blood-brain barrier, this causes higher amounts of opioids to leak across, get into the brain, and cause addiction, cause tolerance, and cause side effects. What my laboratory is looking at is trying to understand what the exact mechanism in which acetaminophen causes damage at the level of the blood-brain barrier. And when we uncover what those mechanisms are, we're hoping that we can design strategies that can protect the blood-brain barrier and therefore control the amount of opioid that gets into the brain, thereby making them much safer, and by extension, by making them safer, they're going to be much more effective for use in treatment of pain.